So we'll give it hello everyone, we'll give it a couple minutes before getting started.
How do you like the fact they included normal IC in the answers?
Gotta get the most votes.
I kept trying to click on it, but it says panelists can't vote.
Oh, you didn't see the question before? Sorry, it was just.
But will the question come down when we start? Because we can't vote. Oh, I can exit out.
Okay, so in the interest of time, we'll just get started and hopefully people will join. So welcome to today's wellness webinar by SCAI, Pragmatic Approach to Achieving Wellness in Interventional Cardiology. I'm going to introduce our panel members, but first I'd like to wish Dr. Hari Naidu a very happy birthday. He's celebrating his birthday today. All right, let's go to the full screen if you don't mind. All right, so this is going to be our agenda for today. We're going to have 3 talks: Understanding Burnout in Interventional Cardiology by Dr. Duffy, Causes of Burnout and Solutions to Deal with Burnout by Dr. Scantlebury, and Dawn Scantlebury, and Leaning into Wellness by Dr. Ajay Kirtne. And then we'll have a little bit of closing remarks and then close it out. This is going to be can you move that? This is going to be a recorded webinar, so it will be posted for viewing later. So my name is Poonam Belgapudi. I'm a structural and interventional cardiologist. I trained at Brown University and Columbia University, and then worked at University of Nebraska Medical Center for a couple of years before I quit there for family reasons. And then right now I am part-time. I work about 10 to 14 days a month and have some time for family that way. So talking about wellness, I thought I'll just share that story. So our panel today is going to be next, Dr. Sena Kilik, who is an amazing interventional cardiologist at Peace Health, an early failure member who loves hiking and traveling. And this is her wellness tip from her recent trip in Turkey. Our next panel member is Dr. Srihari Naidu, who's an interventional cardiologist at Westchester Medical Center. And he enjoys working out at fancy locations, I believe. He's a leader. He's one of the leaders in SCAI and going to be president in the near future. Do you have a comment, Dr. Naidu?
This was taken on a cruise trip when I was with my son. So we always do a father-son trip every summer, and this year we did a cruise. So I think it represents sort of all the happy stuff for the summer.
That's awesome. Our next panel member is Dr. Hadi Licha, who is an interventional cardiologist at Ascension St. Thomas Heart. His wellness tip is, his wellness secret is the sauna.
Is the sauna, followed by a cold shower and my favorite music.
This is really unreal in terms of pushing the reset button after an intense night of call or a long day at work. Just the endorphin release is unreal.
Awesome. Then we have Dr. Soha Iqbal, who is at the Mass General Brigham Salem Hospital. Her wellness is trips to the beach with her little daughter. And then we have Dr. Islam Abdai, who is at the Charles Drew University, and his passion and wellness secret is flying. All right, with that, we can move on to our speakers. Our first speaker is Dr. Peter Duffy, and he is going to be speaking about an understanding about burnout. He's an interventional cardiologist at the University of North Carolina, Purdy Hospital. And he's recently been in the flood hit areas. And so he's going to talk a little bit about that. And then he's going to talk about burnout and interventional cardiology. Welcome, Dr. Duffy.
Thank you very much, Dr. Michael-Pudi. I appreciate the opportunity to be here with everyone. And I'll just move on to the slides there and start this great session. If I can have the first slide, please. It's on definition of burnout. Is that up there? I can't see it on my screen. There we go. So what really is burnout? Well, burnout really is emotional exhaustion that's caused by prolonged and excessive stress. And it can be mental, physical, or emotional. And when we get to that point where you're just exhausted in any of those ways, you're pretty much going to be burned out. Next slide, please. So burnout doesn't just affect cardiologists, it affects really the workforce. And this is some data that comes across from the general population of people who work, essentially. And it says that, well, what causes burnout for the average worker? Well, the stress feels never ending. There's no control over how the job's done. It requires tasks that conflicts with what you really want to be doing. And you end up working toward a goal that really doesn't resonate with you. When you're doing that over and over and over again, and you have a lack of support from the infrastructure that's there to help you get your job done, that can cause burnout. But let's look next on the next slide at how we can relate this to cardiologists specifically. So the American College of Cardiology back in 2019 collated a study where they surveyed a little over 10,000 cardiologists and got about 2,100 responses. So this is about a 21% response rate of cardiologists to this. So it may not be completely representative because obviously people who were more concerned about burnout may have been more likely to fill out the survey. But I think it does create some interesting points for us to look at. And the first is that 19% of cardiologists who responded to the survey reported occasional burnout, 6% said it was frequent, and 1% said it was serious enough that they were actually seeking help for the burnout that they were experiencing. So what are the risk factors for being burned out in cardiology? And this is, again, from this study by the American College of Cardiology. If you can just go back one slide, please. There we go. What are the risk factors there? So really, it was being not compensated appropriately for the work that you were doing, family responsibilities hindering your professional work. You weren't able to achieve your professional goals. Mid-career physicians reported burnout at a higher rate than early and late career physicians. Feeling not fairly treated at work, being not valued for your performance and your input. Females reported more symptoms of burnout than males did. And again, dissatisfaction with family life played a role there. So this work-life balance does come into play when it comes to developing burnout. Next slide, please. So what are the signs of burnout? What should we be looking for in ourselves and maybe seeing in some of our partners there? Well, first, feeling overwhelmed, emotionally drained, and really unable to meet the constant demands. You're frustrated, basically. You're losing interest and motivation in what you're doing. You're cynical or resentful. You feel like you have nothing more to give. You really can't maintain that work-life balance. You're removed from your work, basically. You don't feel connected to the people who are involved in the people that you're working with. You're listless, tired sometimes, lacking the energy to do the job well. And frankly, in some cases, not caring for doing the job well, just assuming that because you know how to do it, it must be getting done well to start with. And feeling at the end of the day that there's very little satisfaction, that you're kind of taking for granted, and you're just maybe a cog in a wheel there. You're not really contributing to the success of the enterprise that you're in. And ultimately, maybe even doubting your skills and abilities. Next slide, please. So what symptoms might we find in people who are experiencing burnout? Well, chest pain, palpitations, dizziness, fainting, and headaches have been reported. And that was, again, from this American College of Cardiology survey of physicians who reported that they felt burned out. Next slide, please. So let's look first, again, at how we get to burnout and what precedes that and what we can do to kind of prevent and understand where we're getting into it. And I think this is a very useful bell-shaped curve. It looks at pressure versus performance. It's sometimes called the stress curve. And at the far end on the left there is what's called bore out. And bore out basically means you're in a very low pressure situation. You have very little performance. And so you really feel not challenged by anything. And that's not a good situation either. That may be something that you can be a little couch potato and watch TV for a while. But after a while, you really want to feel like you've got something to give. You want to be challenged. You want to be able to do something. So the next step really moves into the ideal zone, which is the comfort zone, moving into what's called the stretch zone. So the comfort zone basically is where you feel like you're challenged. You have to be thinking about what you're doing, but you don't feel stressed about doing it. And an analogy I would think for myself, at least, would be doing a diagnostic cath. So, that's something extremely comfortable with, not really a high pressure situation, but you do have to be focused. You do have to be attentive to what's going on, but it's not the highest stress situation. But to really feel you're getting your best performance, optimal performance, you really have to move into the stretch zone. And I think for us as interventional cardiologists, that may come more into play when we're doing an intervention or a structural procedure where the odds are higher that we may run into complications or face issues that are going to be more challenging that we really have to think more about. And every action we've got has maybe a little bit more consequence than basically doing a diagnostic study. So that really may be the optimal performance zone for us. We're focused for that period of time thinking of nothing else. And I know, at least for myself personally, I really have a low attention span. I've been told that all my life from like first grade on. But when I'm in the cath lab, nothing else matters. Nothing. Nothing else can be going on. I'm just focused on that. I don't know how that occurs, but I think for most of us, that really pretty much is the case. That's all we're concerned about. But it can be too much of a good thing. And I think strain is where we start to then move into the area where we need to start being concerned. And strain, for example, might be all you're doing all day long are high-risk cases, and you're doing that over and over and over again. Well, you might think at the beginning, hey, I'm this really great person that they need me in there. They need me to do this. I'm the most valuable player. You've got the cath lab there. So of course, I'm going to have to be in there doing these things. But realistically, if we continue to do that over a long period of time, it weighs on us. And it weighs on us in ways that we see fatigue, frustration. We may lack concentration at some points. We're not as focused as we used to be. But psychologists have said that we create what's called the zone of delusion when this happens sometimes. We actually think we're doing better. We think we're more important. We think we're more focused when in fact we're really not. It may take somebody else to tell us that. So that's the zone of delusion. And then if there's too much of that strain, in other words, if we're doing that all the time, and to take an extreme example, it might be somebody who's covering ad hoc PCI all day long. You've got invasive cardiologists doing your studies. You've got 8 cath labs, and all you do is go from one high-risk PCI to the next over and over again all day long. If you got to that point, you're too strained and you're going to get burned out. So I think there's really a continuum there. We want to find a happy medium. The happy medium is the comfort zone, the stretch zone. We can get into the strain zone, but once we get in the strain zone and stay there, then we're at high risk of getting into the burnout zone. I should say also, this is going to be different for different people. There's no such thing as one size fits all here. There's folks who really, are going to be strained even in a comfort zone. Somebody's very comfortable in it. Other people may say, that's my strain zone. So we each have to learn where our happy spot is in that there, and not really step and try to judge what other people are doing there, but look within ourselves to see where we are in there. And if we have colleagues that we see are having problems and asking questions of us, if they need help, stepping in and try to put it into this kind of context as to where they are and where we hopefully can get them back to being. So that's a short introduction to burnout, what the risks are for burnout, what the symptoms are of burnout, and where really stress fits into what we want to have as pressure, but not too much pressure.
It's a great talk. Thanks, Dr. Duffy. So I may just pitch the question to some of the more senior folks. I say senior, but just in terms of, being in practice the longest, maybe Peter, Hari, and Ajay. What do you think? How do you think interventional cardiology has changed since you all started to now? And do you think there's more reason to burn out these days, or was it worse in the past? And how do you see the field moving forward?
Harry.
I can start off, and then I'm interested to hear what Peter and Ajay say. Look, I think the field has gotten difficult. I think look at different things that have gotten better, some things have gotten worse. I think our techniques and tools have gotten better. So in some regards, things are better in terms of procedures are quicker. But that being said, we've gotten into more and more complex procedures. Coronaries have become more complex. There's more imaging. There's more physical stress on the body, and we're all realizing that. I also think that what we're willing to deal with has changed over time as well. And some of that first generation of people going into this field, they had that exuberance, but it wasn't as much volume and complexity as we have now. So I think the other thing that's really happened is the EMR and the complexities of how the systems work, and that everybody's employed by hospitals. So we have much less autonomy over our well-being. And so that all plays into the stress. I think what Peter mentioned is loss of autonomy and not feeling like you're doing what resonates with you, or that your mission is aligned with what you're doing. And I think those are all the causes right now that I see have changed more frequently now than what we had back in the past. So some of my initial thoughts on this, but Peter and Ajay.
Ajay?
Yeah, I mean, look, I think that for me, the biggest factor is the way that administrations and compensation schemes are set up these days. Our view systems, which I think are like the bane of everyone's existence, frankly, contribute a lot. And I think that the human element of what we do is something that people sometimes forget. And if you lose that element, then it's just a job. And it's not a great job when you're putting patients' lives at risk at times. So I think that if you lose that human element, that's the biggest way that I think the burnout bug really starts getting on you. And you have to then put aside a lot of the administrative hassles and struggles and everything and still get your way to that human element in a way to sustain yourself, especially over a long career, because the novelty of whatever you're doing kind of fades a little bit. Like you know how to do a basic PCI, and that doesn't change. It becomes pretty straightforward. You can add new tools and toys and things like that, but it's going to get mundane after a while. The human element is the thing that sustains.
I would just add to that I think, what Harry's alluded to and Ajay's spoken of as well is, we always say sicker patients, but they really are sicker patients. We've got people with much more complex medical conditions that we have to deal with now that we have to be thinking about when we take them to the cath lab. We're doing higher risk procedures. We're taking a lot of people with shock now from the emergency room right to the cath lab there. So a lot sicker people. And the point then becomes expectations are a lot higher. Expectations now are, if you make it into the hospital, the cardiac arrest, well, you're going to walk out the next day. And if you don't, what was wrong with the cardiologist that took care of you? We've all experienced cases where you go and do a diagnostic case and you have to tell somebody they need surgery, and they look at you like, what kind of doctor are you? Nobody gets surgery anymore, but it gets stents. Why can't you just put stents in and fix that whole thing? So our expectations are higher. And then thanks to the great work that SCAI and Harry's done on shock, for example, expectations are higher that people are going to survive shock. What used to be, well, they didn't survive, they just didn't survive. Now you're under a microscope as to, well, let's go through exactly what you did through this entire procedure to figure out, could you have done something better? And it's a great learning experience, but it also puts us under more stress because we're under more of a microscope with our colleagues looking at that. I think that's a good thing, but it does create more stress.
That's true. I mean, back 15, 20 years ago, we didn't have all these registries watching us, public reporting and these things. And it is very true that we're doing sicker patients, because Ajay and Peter and I can remember when the shock trial came out, and for a while we were not doing anybody over the age, I think 75, because the registry data showed that we were hurting them. Think about that. 75 was considered too old to intervene in what we'd consider very high patients. Now that moved to 90 years old. So it's very common we're doing 75 to 90-year-old patients all the time. And so we're operating on a stress level that's very high, superimposed by registry data, quality, EMR, medical legal, all these things that are much worse now, I think, overall than they have been in the past. And that's just the clinical aspect. We haven't talked about balancing your life and making sure you find happiness in other ways to prevent burnout.
Yeah, maybe I can ask Dawn about the some international perspective. I know you were the sole operator there in your practice for a long time. Did that burn you out? How did you cope with things?
Well, I kind of give my personal story in my talk coming up. But most of my frustrations aren't really the stress of being in the cath lab, because I actually do very simple stuff. It's actually making my cath lab take over. It's figuring out the supply chain, figuring out equipment issues, dealing with administration, dealing with procurement, nursing. That is a huge part of my frustrations. And then it isn't just the cath lab either, because majority of my practice is actually general cardiology, and it's being one of 4 cardiologists in a public health system for the whole country. So it's a lot of work in general and a lot of frustration. So, but I expand a little bit more on it in my talk.
All right, well, let's introduce Dr. Scantlebury. Alan, if you want to go back to the slides. So Dr. Dawn Scantlebury is a cardiologist and senior associate lecturer at Queen Elizabeth Hospital, University of the West Indies. And I'll let her tell a little bit about her wellness regime here, and then take us through her talk on causes of burnout and solutions to deal with them.
Thanks. Thanks all for having me. This is a Tai Chi class, and I'll talk a little bit more about that as well. I'm going to share my screen. If I could find the presentation, sure. So we're going to talk about causes and solutions of burnout. So we've all seen these images, the burnt out matchstick, healthcare workers all burnt out, and I particularly like this one with the battery image, where the battery is on empty. So my journey with burnout starts the end of 2022. Part of this, this is when we were a work group, not a committee as yet. And one of the things that we had done was to trial this online mental health therapy app. And so we had this free trial for a few months, but part of it, they give you give them your credit card, and you just have to remember to cancel it before the period of time is up. And I joined the app. I did a subscription and forgot about it and didn't do anything for it. And then unfortunately, I also forgot to cancel. So my credit card got charged. So I'm like, okay, I could as well take advantage of it. And I did, part of signing up was to get a therapist. You answer all these questions, or what are your preferences and values, etc. You get a therapist and you do some sessions with a therapist. And I remember during one session thinking to myself, I am wasting my time. And I'm just telling this woman what she wants to hear. And I am not doing this anymore. But so I canceled the rest of the sessions with her because, of course, by the end of the month, I forgot to cancel the subscription again. So my credit card got charged a second time. So I had a few more weeks left. So I decided to do some group sessions. And one of the sessions was on burnout. And they took you through these different phases or stages of burnout. So there's this 12-stage burnout construct, and then there was a 5-stage construct. And because I'm busy and I kind of have a little bit of ADHD, there's no way I was going to go through that. But this 5-stage thing kind of resonated with me, on honeymoon phase, etc. And it was much easier to navigate. And I had an aha moment. And at that point, I went over my life and I thought, all of these people are talking about burnout. And I'm like, I'm fine. There's nothing wrong with me, but I am the definition of burnout. And sometimes introspection or retrospection or whatever is necessary. So I kind of took a step back and walked myself backwards throughout my career since fellowship and thought, I really need to make a change. Otherwise, I will be completely burned out. So I'm going to take you through that retrospectroscope that I did. So my honeymoon phase, I finished fellowship 2015, went back to Barbados. As I said, I was the only interventional cardiologist in our public health system at the time. So I actually started the PCI program in our hospital straight out of fellowship. So public job, we are, even though we're not quite an underdeveloped country, we kind of are in the public health system, and very, very underfunded. But I got the program up and running. Yippee. It's general cardiology I'm doing as well. My echo list was actually under control. I was doing all of this. I joined the university as adjunct faculty. I started volunteering as a medical director in cardiac rehab. I was doing all of this, and I was feeling on top of the world. The more the merrier. As you can see, I had this cape going around on my back, and I was killing it, I thought. So then, as the years go by, and the problem when you only have a few cardiologists, everybody, as I thought, wanted a piece of me, because I was giving talks. I, was made myself very available. So the hospital administration, had these special projects with that they wanted to get started. I had my own pet projects for mortality reduction in myocardial infarction in our country, because our MI mortality is pretty high, and I was gung-ho about trying to get that down. And then I had all my previous commitments. I got my first employee, who was another source of stress. And as I said, this is the onset of stress. But I thought I was handling it, but, it was no longer, I am superwoman. Then a few years later, I was also very involved in medical education and continuing medical education. And our foundation decided that we were going to put on this symposium. So it was a 2-day CME event that I had planned. And that was, it took a lot, dealing with sponsorship, et cetera. And then there were all these other responsibilities. And the public system was extremely inefficient at this point. I think initially, the shine was off of my PCI program. So initially they were giving me whatever I wanted. But then by 2018, 2019, when I ordered stuff, things would take forever to come. So at some point we had to pause and stop doing procedures because of lack of supplies. And then, because there's so few of us and so much work, the echoes were piling up. I couldn't get to read all of them. And on a daily basis, I felt like I was actually going to work to do a bad job. And then on top of that, my brother was living with me, and then he bought a house and moved out. And he was my off vent. When I got home, I used to complain to him all the time, and we would chat and drink a glass of wine and just talk about all sorts of things. But he moved out, so he wasn't there anymore. So and then because I was so busy, I wasn't going to my family gatherings as often. So I had less social support, more work, more responsibilities. And, I was feeling extremely stressed out at that point. And, I heard myself it was some radio program, someone was interviewing me, and I was talking about being stressed out. And that was the first time I had actually heard myself talk about being stressed out, because before, there were all these stressors, but I felt like I was handling it. So that is number 3, that chronic stress stage. You're actually starting to feel stressed out. And then going into COVID, before COVID actually started, I think I had reached the burnout stage, but of course, I didn't call it burnout at that point. I was thinking to myself, this PCI program isn't going anywhere. We're doing very few cases. We can't get primary PCI off the ground because I'm not able to get my nurses trained up because we're not doing enough cases to get them trained up. My volunteer role, the Heart and Stroke Foundation was broke. And, I'm like, what role did I have to play with that? I felt like I wasn't accomplishing anything at work. Of course, my secretary I thought was a nightmare and I needed to fire her, but I don't know how to get rid of her. And everything I felt was an effort. And, maybe no one, I was at the one point to say no one cared, but I think at some point in time, I did think that because I felt like I was alone in my bubble dealing with the world. Then in 2020, we all know what happened. Thankfully, at home in Barbados, we had very, very little COVID. So we did this whole lockdown thing, very aggressive lockdown, but we had very, very little COVID in the country. And the whole point of the lockdown was to try to keep COVID out. But the great thing about it was that even though I was working every day and they canceled all our vacations and days off, etc. And there was the uncertainty as to what was going on with the world. There was less traffic, which is a big source of stress, mind you. And because, we didn't have as much, stuff going on in the country, admissions and cardiac admissions dropped. And I think part of it was that people were fearful of coming to hospitals. So less MIs coming into hospital. So I had more time to exercise. I picked up Tai Chi and I kind of went the other direction as far as the burnout curve. But then, as we started to open back up and our COVID numbers increased and our workload increased and exploded. And then into 2021, I myself got COVID and I had this prolonged recovery period after that. But then it was back to the grind with fewer resources because all the money went to COVID and they weren't giving me any money in my PCI program. So I went back on the other direction of that burnout curve. So, one thing that I learned from this retroscope that I've been doing, or retrospection, is that burnout is not unidirectional. So you start off with the honeymoon phase and everything is fine and dandy. And you're gritting your teeth and, it's not quite as bad. You're getting a little bit of stress and you're really stressed out, but you could go the other direction. And you want to arrest this cycle before you get to the point of chronic and severe burnout, where, it could be marked by all these symptoms that Dr. Duffy was talking about, physical symptoms of a headache and illness, actually, and depression. And it can really quite be disabling. So, this little diagram I have is, if you find yourself with these symptoms and this, setup in your life where you're out of control, you're no longer in control of what is going on with you, there is that possibility to actually take it in the other direction. So, going back to this mental health trial, this app, in these group sessions and sitting and listening to people go around the circle and listening to what they were planning to do to decrease burnout. Obviously, I couldn't just sit in the background. I had to actually come up with a plan myself. And my 3-step plan was to turn my lifestyle and my life around, was to remove the chaff, live life, get help, and I'll go through each of these. So number one, you got to identify what were your stressors. So some of them I could quit my job. I'd made a commitment to go back home and help my country, etc. So, my plan at that point was to kind of take the bull by the horns and figure out, what is causing my issues in this public job? How can I deal with this? How can I make things better? And unfortunately, one of the things that I actually did was ultimately, I'm now head of my department. So that's another set of stressors, but at least I have a little bit more control over some of the issues within my department. You have to ask yourself, can this go? Do I have to do this? And not everything that someone asks you to do, you have to do. Learn to say no. Will it add value to your life? Will it get you where you want to be in life? And is this really and truly where you want to be? And I have to say that, yes, I want to be at home. I want to be doing this. It's just, I'm probably going about it the wrong way. So I needed to set a few boundaries. And I'm saying all of this, and I'm thinking myself as I'm preparing this talk, I'm being very hypocritical because I know what to do and I know I'm not doing it, but at least I feel a little bit more in control because I know that I should be doing it, if you understand what I'm saying. The next thing is to kind of live life. So even if on the professional side, you don't have full control, at least you can do things to make life have more meaning. So, at least have a full night's rest. And pray, meditate, do Tai Chi, do yoga. This is a Tai Chi class that I had taken during a conference that I actually planned this year, our Caribbean conference. And I kind of introduced some of my colleagues to the Tai Chi. And I do Tai Chi every Saturday morning. It's 6:30 in the morning, spend an hour and a half and kind of ground myself and calm myself. Exercise is an important part of living life. Even if things aren't going well at work, you can at least burn some calories. And then, of course, we all have vacation, take the vacation. Again, I don't do all of this, but at least I try to take more of my vacation days each year than I usually do. And then if this is not sufficient, you have a support system. You have family, you have your mentors, your friends. Do not ignore them. Don't ignore your family for your work. Don't ignore your friends for your work. Make friends, dates, go out, shoot some pool or whatever it is you want to do with your friends, but you need that outlet to let off some steam. And if you're doing this mental introspection and you realize, hey, I'm a little bit further on this burnout curve, maybe you need some professional help. So you can do that online stuff that I did that was very helpful in opening up my eyes to what was going on. Or you can do in-person stuff or, whatever, but there are a lot of resources out there to help. So I'm just putting this back up again to remind you that this is a cycle. It's not unidirectional. You can go in the other direction. And the goal is to arrest this cycle before it gets to this stage of severe burnout where sometimes, it leads to more mental illness than and can be irreversible as well. So, try to look into your lives and stop it up here, and maybe even get back to that honeymoon phase that we were at. Although the honeymoon phase, it sounds good, but it's actually part of burnout because taking on too much is a sure recipe for further stages of burnout.
That's an awesome talk. Thanks, Dawn. I'll ask Senna, who's the youngest here, I guess, in career years. Tell us about, your experience and, is there anything that caused you to burn out that you turned it into a positive, aspect and help build yourself?
Absolutely. I think one of the benefits of being at maybe my career stage is increased awareness. And so, I feel like kind of looking back and reflecting on my journey, I feel like I burned out really early. I felt like I was riding that burnout curve really in a sweet spot. And then I fell off that curve real quick and really early. To me, it happened when I was in interventional fellowship and had a new baby and was looking for jobs. And I just realized I had so much on my plate and I just was not in a position where I was going to be able to keep all things going with any amount of success. And for me, the realization of that moment was really important. I think I realized it really quickly. I think COVID helped a lot because that happened around then too. And life took a pause and I had a moment to just kind of reflect on how I was feeling. And I realized that I was doing the things I love and being surrounded by the people I love. I had a new baby and she was giving me joy. I had a wonderful job lined up. I was an interventional cardiology fellow. This is what I wanted my whole life, but I wasn't happy. So why was I surrounded by things that gave me joy and I loved doing, but I was not happy? And I realized that I was probably burnt out. And I started by first building a community. And so reaching out to people, asking for help, finding people who are at the same stage of life as me. And then I started setting boundaries. And as hard as it was, I started saying no. And I started walking away from obligations that I just couldn't put on my plate at that point in time. As I expanded my community and the people surrounded myself with, I expressed my concerns. I've done so much to get to this point in my life. Am I actually putting all of that on hold, or is it gone? Have all of my successes are they all going to be gone if I say no to all of these obligations? And the incredible support I received around me by other interventional cardiologists who also happen to be women, who also happen to be new mothers, really helped me move on and move forward. And what ends up happening is every couple of years, or maybe every 12 months to 18 months, I have to do a self-check, a check on where I'm standing at right now, if I'm still happy, or if I need to do something to make myself happier. What do I need to do? And my most recent check revealed that I don't have a hobby that I love. And so that's when I took on hiking. And I realized I love hiking. I love disconnecting from the world. I love listening to the sound of rushing water. I love listening to nature. And I love being there. And when I come out of that situation, hot and sweaty and just, really exhausted, I feel recharged and ready to take on the day. So that's how burnout happened for me. It happened really early and I was so surprised, but I think it taught me an incredibly valuable lesson. And the lesson that I would kind of pass on to others would be to just do a self-check. And if you can't check yourself, find others around you to check yourself with. Ask people around you if you're doing okay, because people want you to succeed. They want you to do well.
Yeah, great. In the interest of time, we'll move on to our next talk, which is Dr. Ajay Kirtne. If you want to put up those slides again, Alan.
Actually, I can do it. Can I share?
We're just going to introduce you quickly.
Yeah. Go ahead. Sorry about that. Sorry. So let me unshare. My bad. Sorry.
I think we have a fun video of you playing the guitar. I don't know how many people know that. So this is Dr. Ajay Kirtne, who's going to be, he really doesn't need an introduction, but he's the director of Columbia Interventional Cardiology, playing the guitar actually, and he and Dr. Stefan at a meeting. This was awesome. All right, well, we'll let you show the rest of the video in your presentation.
No worries. So thanks so much for having me be part of this. And I think that the title of my talk is really talking about work and life separation and personal separation from work, and whether that's possible, whether it's desirable, how do we do it? And so I figured we'd start with 2 votes. So the first vote is going to be, and just so you can do this to yourself, think about it, is personal and professional life separation important? And I would dare say that pretty much everybody would look at that question and say, yes, it's obviously important to separate our personal lives from our professional life. But the second vote is personal and professional life separation possible as a practicing, busy clinician interventionalist? Is it something that we can ever even try to accomplish? And I think this discordance between these answers, because the first one everybody would say yes, it's important, the second one say no, we can't really do this, is the crux of what can get to a lot of what we've heard the prior speakers talking about is burnout. And hopefully through this talk you'll sort of hear my philosophy on a way of combating it. I don't think I have a solution or anything like that, but just some observations about myself, about our careers, and what it is as an interventionalist. I think most people know this guy, Jeff Hartzler. It's interesting, many trainees coming out, when you show pictures of Grunsig, Hartzler, et cetera, they may have heard the names, but they don't really know who they were, what they stood for, what they were like. But really, first primary angioplasty and acute myocardial infarction is, what he's known for. But the other thing that most people don't know that he was known for was that he really was, at the time when balloon angioplasty came out, the sort of best operator in a sense for these types of cases. So basically everyone's failed cases got sent to Jeff Hartzler, and he would have to do them. He'd have to line up and do them. And remember, there's no stents, so abrupt closure is happening, all kinds of stuff is happening. And what people don't really know about him, and I only learned this because Marty Leon told me, was that sort of he had an untimely demise. It was tragic, but this wasn't related to that. But in the end of his career, when he was getting all these films, he basically couldn't look at the films in advance of the day he was going to do the cases. Because if he looked at the films, he would think about all the bad stuff that was going to happen. And to Peter's point about these high-risk cases and the stress level and all that, it just was something he couldn't do. And as a result, he just shut it out from his own life, because otherwise it would have ruined his own personal life. And so I think what we do as clinicians is not, we shouldn't be doing that to that extreme. And certainly we want to avoid those situations that Peter talked about. But one of the things that we do pretty well, and we're kind of trained to do without formal training, is to compartmentalize. So we kind of see some horrible thing happen or bad news or a really busy day, and we kind of deal with that at work. And we're really good at shutting that out and then going about our way with the rest of the things we have to do. And I think I remember this vividly from being a med student, and nobody ever told me that this is what we should do. It just seemed like the obvious way to deal with bad stuff going on, because how the heck else could I confront it? And so we're often just do this by observation, and we're kind of taught how to tell patients about bad news, but we're not taught about how to react to it ourselves very frequently. And so we kind of learn this behavior from observing those around us. And the question is, does that mean that we do it right? Is this the right way to do it? And certainly, is this the best way to train trainees, and to sort of just say, just watch what I do and you figure it out whether that's good or bad for you in the whole. So I think it takes a lot of self-reflection to kind of think about, is it good for us and does it work for me personally? And I kind of learned this serendipitously in the pandemic. We heard Dawn talk about a little bit how the pandemic left some time for reflection, et cetera. But one of the funny stories that happened to me in the pandemic is that I still remember that first day where I converted my entire clinic to telehealth. And so I did it at home. My two kids are teenagers. They're in high school. They're at home. My wife is home. And I went upstairs and I did my whole telehealth. I have like a standing desk with a treadmill underneath it. I wasn't on a treadmill, but I did my telehealth. And I was tired because I'd never done this before, like 20 something patients in telehealth. And I come downstairs, and at the bottom of the stairs, like as I'm coming down, I vividly remember my wife, my daughter, and my son, and they're all looking at me with their mouth like wide open. I'm like, what's going on? Why are you staring at me that way? And they're like, you're so nice, because they had never heard me be that way when I'm talking about the hospital, because I'm always on the phone, like, grumbling about something, this, that, and the other. The other part, so when we started talking about that a little bit at home, because I started laughing, was that I realized is that this is me in the cath lab. This is during a live case, and this is kind of standard interventional position. We're all sort of standing around. Nobody's making eye contact with anybody else. And we're kind of just like barking out orders. Like, I'll have a 2.5 this, I'll have a rotoblator, call for the this, call for that. But nobody ever, ever in the cath lab makes eye contact. And when I was talking about this other thing about the clinic with my wife, she said, like, while we're at it, like, you do realize that, like, when you're home, you just kind of like shout stuff into the air, asking people to get you stuff or whatever, and you never really ever look at us. And I'm like, that makes sense, because that's what I do every day in the cath lab. So you start learning by thinking, and then when you start realizing that these are completely like maladaptive behaviors for interpersonal interaction. And so we got to get better at that. Now, what's interesting is that there have been calls by various, not just societies, but people in our field as a way of combating burnout, that what we need to do is change how we think about professionalism. And so this was a paper in JAMA about 10 years ago, where they talked about to make the transition from pejorative, nostalgic, to a new type of professionalism, because nostalgic professionalism is not good. We have to adopt something, especially in residency training or otherwise, where the team-based model is used where there's no ownership of any patient individually, but it's shared among a group of team members. And they used examples of the airline industry, the police force, where people are on shifts and then they're off. They're on and then they're off. And they actually used in this paper examples like going home and checking labs as not good behavior because it just leads to burnout. But the thing is, that's crazy is that really possible? Like the whole definition of caring for somebody is you actually care. So when somebody goes home, when I go home and I'm looking for some lab value, I can't just shut that off. I have to think about it. And to sort of subvert that to some other person and me not ever even think about it, I actually think becomes even worse in some respects. So I don't think that that's actually possible to do. It's just how do we manage it so it doesn't overcome our daily life? So that was my gestalt. I didn't know if I was right or wrong, but so I decided to do what my patients do. And I went to Dr. Google and I asked, separating work and professional life. And so here are the first two topics that came up. So this was an article here that said there are real benefits to separating our work and personal lives. Okay. The next one, finding enough time in the week to both carve out meaningful home experiences and complete work assignments seems to leave both depleted, and keeping work and life separate is actually more trouble than it's worth. So like anything, conflicting 180 degrees, conflicting advice on Google. So I started reading some of these articles, and what resonated with me was this, and that is that if you really try to separate things entirely and do this transition between your cognitive roles, that actually can cause more stress because originally you think in an idealistic way, I want to create boundaries. But if I do that, it's actually those transitions. When I'm with my family and I get a phone call, that's the worst possible thing. I get more stressed out unless I sort of accept the fact that as a physician, I'm going to be on call and patients are going to be calling me for things when they're sick, or my family member is going to be calling me, instead of resenting my family members for calling me for medical problems because they don't have anyone else to call. And so the idea here was, instead of leaving work at the office and home at the door, if there's a way to integrate both of those in a healthy way, not in a way where it takes over your life, that might be a better strategy. And so for me, this has involved actually leaning into the things that matter to me. And so this is like my daughter, she's giving a graduation speech. This is my son, he's still in college, he's playing the drums. This is my wife and my dog. And yeah, my dog can't necessarily know what I do at work, but I talk to my kids and my wife about the calls I'm getting. If I get a phone call from the office or from somebody afterwards, I don't just hang up the phone and go back to doing what I'm doing. I actually explain to them what the call was about. And the same way is at work, I actually talk about my wife, my kids, and my dog to my colleagues. And the reason I do that is to try to minimize the separation between the two, because I'm the same person wherever I am. And these are part of me. This is my life. And so if I share that with everybody, then I think that that's a more adaptive way of doing things. The other reason I do it deliberately is because, as the section head of interventional cardiology, there's this hesitancy on the part of junior faculty, fellows, and others to talk about their own lives, because we just don't do that in medicine, do we? We just work. And by me sharing these things, that encourages them to think that this is okay. And it also encourages them to talk about their own lives. And as a result, we're all far richer because we actually experience everybody in every different way. It's also made me a better doctor. I think that this is a slide I like to show when we talk about, as physicians, what we do when we prescribe medicines or talk about procedures. As a physician, we pretty frequently write a prescription and say, hey, just take these medicines and it's going to be great because I know how to treat your hypertension. But most physicians don't recognize the fact that when we write a prescription, only 2 out of 3 patients fill that prescription. And of those that fill it, only 2 out of 3 of those take it as prescribed. So that's a 50% hit rate. And the reason is because we just write the prescription. We say, hey, you're going to listen, it's fine. And we don't realize that from the patient's perspective, this is what they're thinking. Do I really need to take another pill for life for something that I don't even feel? And we have to bridge that gap. And the way we bridge that gap is by being human with our patients and connecting with them in ways that don't necessarily involve medicine even. You just talk to people like they're people. And by being more human that way, that's also how you get back to that anti-burnout sort of tonic, which is the humanistic parts of medicine as a whole. Don't just take my word for it. These are other doctors who are actually well known, SCAI and others, just quotes that we had from our complications course in Seattle. Alex Truesdale, we're always on. Jared Fazell, home makes me a better doctor because I bring that to home. And then this is a text message from one of my colleagues, Megha Prasad, who had an unfortunate death in her family. And I asked her about a work-life balance talk, and she said, my 2 cents are choosing the right people to work with, which goes a long way. My support, Margaret McIntaggart, who's our cath lab director support, as she heard the news yesterday, and in general, as I navigate family life with work, makes all the difference. The environment you all have created has made work also enjoyable and fulfilling, so it's integrated into life. I didn't tell her to write this, she wrote this. So I think working with and for the right people is a critical way to achieve balance if there is one. Thank you. For me, this is a clip of my family. This is my wife, my son, me, my daughter, my brother, my cousin. We're playing music at a wedding. This is the type of stuff I like to do. I share it with folks at work, maybe too much. So I'm not going to play you the clip because you already saw a clip before. But this is us. We're an Indian American family. We are dressed in full Indian garb for a wedding, and we're playing a Frankie Valli song. That's who I am. I talk about my Indian American heritage in the hospital instead of when I was a kid, basically being totally embarrassed of my mom wearing a sari because I was just an American kid. But then I realized I'm actually brown, I'm actually Indian. We should lean into these things. And so for me, it's totally befitting that we're dressed like this and yet playing American show tunes. So some final musings of this talk. Remember, you're physicians or clinicians. You're not a provider. To me, the word provider is complete BS. And maybe I'm seeming old by saying that because I know many people have adopted it, but I don't provide a service. I actually care for patients. And it's a true privilege to do what we do. And if I lose that feeling that it's a privilege, then I need to actually, do what Dawn talked about, is find some other way to get back to being a clinician and someone who actually cares for patients. There's no question, as Peter said, that when you're doing a case, you don't want to be distracted with the humane element of the patient in front of you because it's going to make you freeze. So we're more efficient, focused, and present when we separate and compartmentalize activities, either professional or personal. We can just get the job done that way. And distraction is going to be an enemy. But we need to come out of that so as to realize our humanity. And it's virtually impossible to separate our professional entity as physicians from our personal life, and in the case of a physician, vice versa. Just say in closing, it's far easier, fulfilling, and human to be consistent across all of our various roles. I'll share this with you. This is by Arthur Brooks. He is a sort of a self-helpish guru of a sense. And, there's 5 acts you can do each day to make yourself feel better. Help other people out by serving them tea, smiling at yourself in the mirror, changing your places with somebody who you might not like so as to understand where they're coming from, and then let things go. And if you're interested in more stuff like that, there's a ton of information out there, books you can read and beyond. And this is just a plug for him going to be at TCT, and he'll be speaking about these types of things. And we deliberately picked this type of topic for a keynote address, for instance, as opposed to other meetings where you may get politicians and other people like that, because I think this is a really important thing to talk about, how we can get back to the humanness of what we do, irrespective of our profession. So I hope that was helpful, and happy to take any questions at this time.
That's awesome. Thanks a lot, Ajay. I'm going to ask Islam, who is on the Wellness Committee at SCAI, a little bit about the data that was sent out to SCAI members on cath lab related injuries and the wellness aspects that people follow. Maybe you can quickly share in a minute or two the highlights of that data. I just wanted people to know that there is that aspect to the cath lab as well.
Of course. So the biggest findings we found on this survey was that it actually is very similar to the 2004 and 2014 survey, 2013 survey. 14. And then the 2023 survey essentially emphasized that we haven't really made any progress in terms of the amount of stress that physicians are under. So, for example, the orthopedic injury rates are, if anything, slightly higher, not statistically higher, but they are significantly higher than the general population. So you have cervical spine, lumbar, knee, and hip, and they're very destructive to us as an interventional cardiologist. No other career, no other job allows people to be in such risk of injury as interventional cardiology that I could find. And we've looked up the data. So other specialties such as orthopedics and interventional radiology have similar rates, but ours tend to be really considerably higher in some aspects. By the way, that includes the full spectrum of injury: cataracts, malignancy, skin injury, renal injury, and so on. So we tend to minimize this. I think Dr. Lombardi's talk in the most recent SCAI meeting in March really emphasized that. We tend to be very motivated as a specialty. We are, I wouldn't say aggressive, but we certainly tend to, at the cost of our own selves and well-being, tend to push ourselves. And there's a cost to that. We are human. I know some of us deny it, but we are. So what the survey also described is that we're doing more cases now. Going back to Don's talk, we do more cases now. We are actually busier than we've ever been. The structural rates have gone up. The coronary rates have gone up. The only thing that's really gone down somewhat has been the peripheral interventions. Having said that, we do more cases, but we don't have better protection. The rates of adoption to radiation protection equipment, orthopedic mitigation equipment, and so on has not improved hardly at all. In fact, not at all. And that is also telling. So there's a lot we can do for ourselves, but we also will need the help from each other, from the society. I hope that answers the question.
That's great. I'll also ask Dr. Soha Iqbal from a female, interventional cardiologist and being a wonderful operator and just a SCAI leader as well. Just to, what are your what's your take on Dr. Caithney's talk? Anything that you want to stress on and just kind of share with us? You're muted. You're muted.
Some of my thoughts that came from everyone's talk. One thing that's highlighted throughout this that we don't have a lot of time, so I'll just say, I was taught very early on, we're happiest when we can focus on one thing at a time. So that's probably why we all love interventional and cath, because when we're in there, you can't think about the administrator, the in-basket. I wish our patients could fall asleep a little bit more because their expectations have changed. And so they're asking me what I'm doing at every step, which I would love to stop. But other than that, happiness is when we can focus on one thing at a time. And I think that's just something to think about as you juggle. We have to juggle, like you said, as a woman, female, we have home and family, which I think everyone is still is really incorporating in their life. I have, administrative and leadership responsibilities, but when I'm in the cath lab, I try to focus just in the cath lab. And when I realize that I'm unhappy that I'm in the cath lab, it's usually because I have 100 things on my to-do list. So, all the things that we talked about, you have to enjoy when you're in the cath lab and then figure out the boundaries around the side. And yeah, I'm all about being human and enjoying the little things and talking about it. I got to stay with my daughter for breakfast and make her lunch this morning, and everyone heard that today because I had a meeting canceled in the morning. And I think that's what we need to do, is relish those moments, talk about them, make it part of who we are.
That's awesome. I know this topic is extremely important. We have we have close to 300 members watching this live on social media. It's great to see you all, and hopefully I'll see you all soon in person, and we'll celebrate Dr. Naidu's birthday. But in the interest of time, we'll have one last comment from each one of you. Just share what keeps you well, what keeps you active, what keeps you going, and a quick suggestion for the fellows and early careers to be successful in their careers like everyone here is. So we can start with Islam. You're first on my screen.
Thank you. So I just wanted to say that I definitely resonated with both Peter's and Don's talk. The trouble we have is that we tend to not know how to say no, and surrounding yourself with good people really mitigates the risk of burnout. At one point, I was building programs, teaching, publishing, and involved in leadership in excess of 60, 70 hours a week, and then work on nights and weekends, 2 or 3 weeks in a row, to the point where I couldn't say no. I just didn't know how to say no. So unbeknownst to me, my administrator would actually intercept my emails and email back no's, a lot of them. And I wouldn't even know about it till much later. So I'm very grateful for people like that. Surrounding yourself with people like that, surrounding yourself with colleagues that you can talk to, especially after a complication, especially after an incident, is invaluable. And we tend to have the unfortunate tendency of deluding ourselves into a zone of delusion, as Peter mentioned, so that sleep deprivation and hard work becomes almost the rule. Sleep deprivation is not much different than working under the influence. And if it's not okay to drive under the influence, or certainly do anything important under the influence, it's not okay to practice medicine in that fashion. So it's not only damaging to us, it certainly is, it's damaging to the people around us. So thank you for putting this together.
Sano?
I think one of the things that drives me the most is I look at my daughter who's 5 and I ask myself, if she were me and I was my mother, what are the things I would say to her? What's the kind of life I would like her to live? And I try to emulate that and kind of be that role model for her. I want her to be happy. I want her to be successful, but I also want her to be satisfied with all the things and continue to be curious and adventurous. And if that's what I want her to have and do, I have to model that behavior. So that really drives me a lot in my day-to-day decisions about life, work, and wellness.
That's great. Hadi?
Yeah, so I
Great
think
webinar.
honestly,
Sorry, Hadi. Go ahead.
oh, sorry.
Well, sorry, Hadi. Go ahead.
That's right. So I think honestly, obviously, we're all got to this point in our lives because we're in some way perfectionists and we really want to please people. We're compassionate and we really want to make everybody happy. But obviously, something is going to have to give. And the light at the end of the tunnel is that there is hope in our profession and there's a way to do it. It just takes 5 to 10% of cutting out of in terms of our volume, in terms of procedures, patients seen, days worked, that makes all the difference. If you cut out 10% of your work, you're still going to have the same lifestyle. Your family is going to enjoy you more. And of course, you won't make the administrator super happy about that target RVU, but there is, a fine balance before you get there. And secondly, I think, our job is like a fighter jet job. We have to be super alert at all times. We have lives in our hands, and we're expected to perform absolutely amazing all the time, even if we don't sleep. After a STEMI call, you get a 30-patient clinic day, and we're supposed to function normally. So I found that in today's administrative environment, it's hard to kind of really navigate this and find a balance. The only way I thought was going to be very helpful is all or none technique, meaning taking more days off, pulling yourself out of work as much as you can. And being out of work just doesn't expose you to those questions where you have to say no. And by taking more vacation, even if it's unpaid vacation, I think you can buy yourself your happiness and you're still going to live the same lifestyle.
Awesome. Soha?
I'm going to say 2 quick things. One is we have all been taught how to be really good at what we do. I think what we need to learn and what I learned later in my career is where we're going to thrive, what kind of environment we're going to thrive in. So not just focus on being the best interventionalist, but where, or the cardiologist or whoever you are, but where you're going to thrive. And the second thing, thinking about complications is we really need to learn how to forgive ourselves. I had a complication in the cath lab recently. And I literally in my head said, I forgive myself. And it was the most refreshing thing I've ever felt. And I would love for everyone to get to that point that you could do that because we're all good intentioned and we're trying to do our best.
That's a great point. We have a great talk at Bill's course, complications course in every year. Peter?
Just want to comment on the concept of saying no, because that's one of the things that became much more important for me over the past several years. And it used to be you wanted to say yes all the time because you felt like you weren't forwarding your own career, you weren't being true to yourself, you let somebody down that asked you to do something that you could do. Or the other side of it, and this is the ego part, is they need me. I mean, they can't do without me. I've got to go do this. And really, neither one of them is true. And I really did learn that. It's important to keep that in mind. And I really appreciated the takeaway from me here is going to be Ajay's talk on blending, because normally we think of this work-life balance, and it's that seesaw diagram that we always see, the picture, one end or the other end. But really, it does have to have a little Venn to it there. We have to mix those two somehow. And I really appreciate his thought there of bringing some of the work home, not just they see you doing it, but they understand what you're doing and relate that to the patient that you're taking care of and why you're doing that. And then the same thing at work there, sharing who you are as a person there, I think really builds teams and can give you a lot more job satisfaction and decrease the risk of burnout. So I appreciate this talk. Thanks.
Awesome. Ajay?
Well, one thing, I mean, I guess I can cover that we didn't really talk about too much, and it's a big focus of SCAI this year with Jim Hermiller as well, is making sure you take care of your body, and especially with the radiation risks and the orthopedic risks as well. I'm a very active person. I ski avidly, I run, I play tennis, and I just had my second back surgery this year. So I think that it's something that we neglect. We think we're invincible. We don't even think about it. Make sure you have a doctor. Make sure you're like getting your basic screening and stuff like that. Because that, if you don't have your health, you really deteriorate fast. And when my back was bothering me, I was a totally different person. I was just angry and and irritable and all this other stuff. So just something else to think about as well.
Dawn?
What sustains me. One of the things that I am learning is setting priorities and identifying what are most important to me. One of my, I guess my biggest priority is my faith, and spending that time, prayer, meditation, in devotions. Is pretty important to me. And if I'm working 24 hours a day, I am not spending that time. And it's pretty important to do that, because by spending that time, I'm a little bit more grounded, and I can take what comes at me. So I can do more when I prioritize myself more. So, we have to step back and look at our lives and identify that priority, identify where our grounding points are. And we can always go back to the Superwoman stage, but you have to spend that time and prioritize.
And Hari?
Yeah, I mean, this is a great webinar. There's a lot of take-home points I think people have covered. I think the last thing I'll say is that I think people burn out also, not just because of autonomy issues and support at work, but I think there's a sense that when you're at work, you're working for work and making sure that everybody's happy at work. When you're at home, you're working for your family, making sure everybody at your family's home. But who's making sure you're happy? And so I think there's actually a third bucket, which is how do you make sure that you stay the person that you were? We saw how Ajay does it. I do it by lots of different hobbies and things that if I do those things, my mind can disconnect and I can feel I'm who I am. That's why I made the tweet this morning. How do you stay you? So I would encourage people to find what really made them happy in childhood and as they grew up, and things that they kind of gave away because there wasn't as much time, but bring some of those things back, like music for Ajay or whatnot. And because that way you feel very grounded in who you are. And that's the person your family loved, right? And that's also the person that could share at work and make the environment better. So I do agree with having some personal life at work and having some work in personal life. And I agree with Ajay. I think I've evolved in the same way, which is to make sure everybody's aware of what that is. It's oftentimes hard in family, if they're not in medicine, to understand fully. But even the fact that you're trying and they can get a little sense of it makes you feel a little less conflicted in each of those environments.
This is great. Thank you all so much. It was wonderful having you all here on this webinar today. And I'll be amiss if I don't say thanks to Jim Hermiller, Alison DuPont, Islam, and all SCAI staff and members of the Wellness Committee who've put together these webinars. And so thank you all. And my just takeaway is feel your emotions, because it's not wrong to be happy. It's not wrong to be sad or angry or whatever. And then you come back as a happy person at the end of the day. So thank you all. It was awesome. And have a good rest of the week.